Diaphragmatic breathing for overactive bladder. What is it and why do it? This video was made in partnership with urologist Dr. Stuart Hart and the team of Urology Health. So, from the beginning, when you talk about urinary incontinence, we have like 5 major causes. We can classify it according to it. We have primarily stress incontinence, which does not mean you are under psychological stress. It means your bladder is under mechanical stress, your muscles are under stress. So to speak, if you want to put it in a more like informal way, your pelvic muscles are not strong enough to keep your urethra closed under heavy strain. And so when you make a lot of strength, for example, when you do weightlifting, or in some cases when you sneeze or cough, for example, the muscles around your urethra do not have the strength to keep your urethra closed, and thus urine leaks when you're putting a lot of force, when you're putting a lot of intra-abdominal pressure on it. So it's like a exercise-induced leak, so to speak, because your muscles are under stress. We also have urge incontinence. Urge comes from urgency, and it's kind of a spasm in the muscles that envelop the bladder, particularly the detrusor muscle, but also a bit of the pelvic floor. It means that they contract in an unexpected and abrupt way, meaning that you are perfectly fine and then all of a sudden the muscles contract and you get the urge to go immediately to the bathroom to urinate. I once heard, for example, from a woman in her 20s that she was running, she went for a run, and then in the middle of the run she suddenly got a tremendous desire to urinate, and she had to approach the closest establishment and ask if she could please use the bathroom, or she was just going to urinate herself on the street. And that's precisely the idea. She wasn't overly exerting herself with strength. She wasn't previously already yearning to go to a bathroom. She just suddenly got the urge to urinate. So there we have this kind of spasm, overactivity of the detrusor muscle or overactive bladder. Overactive bladder is a type of urge incontinence. You can also have some other less important types, for example, such as overflow incontinence, less important to our current discussion here, such as overflow incontinence. When you have something physically obstructing, for example, the urine outflow, or when you have a nervous problem that prevents you from correctly contracting the muscles to urinate, or, like I said, the physical obstruction in a man with benign prostatic hyperplasia, for example. If you have a hard time urinating, you have something that's mechanically blocking the flow of urine. The urine will just accumulate inside the bladder until it fills completely, and then it will accumulate the necessary pressure to just overcome that obstruction and leak. So you get like overflow incontinence because you just couldn't urinate voluntarily before. And then you can have, for example, functional incontinence, which is when you could theoretically achieve continence, but because of other factors, for example, dementia, you don't actually function correctly in getting to the bathroom in time, for example. And then you can have mixed incontinence, which is usually an in-between of stress and urge incontinence. So, overactive bladder is one of the causes of urge incontinence, and you don't even need necessarily to have the incontinence part. You might still achieve continence while having episodes of urgency. According, for example, to the definition of the International Continence Society, overactive bladder is defined as urinary urgency, usually accompanied by frequency and nocturia, with or without urgency urinary incontinence in the absence of urinary tract infection or other obvious pathology. So, if you have overactive bladder, if you have urge incontinence because your muscles are contracting too much, almost like spasming, what can you do? Well, one of the approaches, a behavioral one, is diaphragmatic breathing. So we usually breathe of course, we are using a lot of the diaphragm, but proportionately speaking, we expand a lot of the thorax, thus recruiting a lot of intercostal muscles, for example, and we don't really contract the diaphragm, pushing it fully. So one of the approaches says that you could contract your diaphragm and breathe in a very specific way, and that would help with urinary symptoms. Why? What's the rationale behind it? Well, the body is like, they like to say, a closed canister. The abdomen, for example, and the pelvis are a continuous cavity. So the diaphragm in Greek means just partition, a division. So you have like two diaphragms. The main diaphragm, and the one people actually know, is the thoracic diaphragm, which divides the thorax from the abdomen. And then you have the pelvic diaphragm or pelvic floor, which is also a group of flat muscles that divides the pelvis from the perineum. So it's the floor, the lower bound of the pelvis. And we will have a video about exactly what is the pelvic floor and which are these muscles, but for now the point is a floor is the place you step on and which prevents you from falling further down. So the pelvic floor is what prevents your organ from falling between your legs downwards, keeps it into your body, because it's a group of muscles that closes, so to speak, the hole we have in the pelvis, in the bony structure of the body. So, since we have the so-called canister, we have the abdomen and the pelvis, and they are enclosed, you have the thoracic diaphragm up and the pelvic diaphragm down. And if you contract the thoracic diaphragm and push it downwards, it's naturally going to increase the intra-abdominal pressure and the intrapelvic pressure and push the pelvic floor outwards, thus stretching the pelvic floor muscles and relaxing them. So we would have three proposed mechanisms for this. The first one would be that the pure mechanical stretching of the fibers of the muscles of the pelvic floor is enough to relax them and make them less tense, and thus the whole group of muscles involved with urination less prone to spasming and to contracting erratically. The second proposal would be that diaphragmatic breathing stimulates the vagus nerve and thus the parasympathetic system and helps to achieve muscle relaxation. And the third would be that there's also a psychological component to it, so to speak, that purely for breathing slowly you would relax and thus achieve some psychological degree of behavioral therapy control over your pelvic muscles. Is there strong evidence for it? No, not really. There have been some studies, but very few have looked specifically into diaphragmatic breathing. Those that have contrasted diaphragmatic breathing with, for example, pelvic floor muscle therapy, usually show that pelvic floor muscle therapy is superior to diaphragmatic breathing. That said, is there a benefit in adding diaphragmatic breathing to other treatments? Inconclusive evidence. So, why would you do it? Why would you recommend it to a patient, for example, if there isn't sufficient evidence in it? Well, primarily because it's mostly a low-cost, low-risk intervention. If you're going to perform a surgery on someone, for example, or prescribe them a drug with a lot of adverse effects, for example, you better have a very strong scientific backing to do it. If you're going to submit someone to a surgery, make damn sure it's going to have some effect, or at least that you expect to have some effect. When you tell someone to breathe in a certain specific way, what's the risk or cost involved with it? Pretty much none. Virtually none. So That's essentially why diaphragmatic breathing is one of the interventions, because, so to speak, it might work and it costs pretty much nothing to do it, so why not try it? That's essentially the simplified rationale, and we have those three mechanisms to explain supposedly why it could work. So, how do you do diaphragmatic breathing? Well, I'm going to read precisely from the description that was kindly provided to me. So, step 1, inhale slowly. Breathe in slowly through your nose. Focus on filling your belly with air, allowing it to expand outwards against your lower hand. You should feel your abdominal hand rise. Your hand on your chest should remain as still as possible. Mentally visualize or feel your pelvic floor expand away from your body as if opening like rosebud petals. That's a very interesting metaphor. I wouldn't have thought about it, but well, okay. Aim for an inhale of about 3 to 4 seconds. Step 2, exhale slowly. Exhale slowly and gently through pursed lips or through your mouth. As you exhale, tighten your stomach's muscles gently, allowing your belly to fall inward and your lower hand to lower. Your hand on your chest must remain as still as possible. Feel your pelvic floor moving closer to your body or gently drawing back together. Aim for an exhale of about 3 to 4 seconds. So it can be done in other positions, but it's usually done by beginners laying on the ground with knees bent, one hand over the chest and another over the upper abdomen. So the idea here, for example, with the bent knees is to make sure that the back is perfectly lying flat and that the pelvic bone is positioned correctly, and the idea with the hands is to allow the person practicing it to notice how they are expanding way more the abdomen than the thorax, meaning that you are doing more of an abdominal, a diaphragmatic breathing, and less of the shallow breathing that we usually do, or even a deeper but still primarily chest-related breathing. So there you have it, 5 primary classifications. I wouldn't really say causes because you have different specific causes for each of these types, but 5 primary classifications, causes, great causes of urinary incontinence, stress, when you have incontinence under strain, under strength because your muscles are under stress, urge incontinence, which includes overactive bladder syndrome, where your muscles are contracting, particularly the detrusor, but also with some lack of coordination of the pelvic floor muscles, contracting abruptly without need, and also mixed causes, overflow incontinence when you have a mechanical obstruction or a nervous impairment, and functional incontinence. And when you talk about overactive bladder, in this specific video, we mentioned the diaphragmatic breathing behavioral intervention, which doesn't have the strongest scientific backing, but is still used because it has low cost and low risk, and consists essentially in trying to focus on breathing more with your diaphragm and with your abdomen and less with your chest, with the intention of also expanding the pelvic floor muscles and thus 1. Stretch and relax them, 2. Cause parasympathetic activation through the vagus nerve, and 3. Have psychological relaxation effects on the patient. Well, that's pretty much it. So, thank you for watching and see you on the next video.